What I'm really impressed with by the conference is the level of interaction and engagement, both in the sessions, but also just walking through the hallway. And it's been great to have the chance to engage with the Philadelphia cell and gene therapy community in person at a venue which is small, share a cup of coffee, and I'm just really having a great time.
We'd like to have as much evidence possible, but sometimes it's just limited by the size of patient population. So I think it's a matter of really trying to understand the underlying disease to the best extent we can, and then basically looking at the potential benefits of the therapy versus its risk in the context of, is there anything else out there for treating that disease? In many rare diseases, there's nothing else out there. And I think if we can convince ourselves that there's a reasonable chance that there's benefit, we can accept a certain amount of uncertainty that we then resolve in the post-market setting by getting additional data when we do either follow the patients longer or have additional patients treated.
But it wasn't as bad as it was in 2000 because we have had some wins. We have approved products. So, it will come back. There's a lot of turbulence politically, economically, research-wise, lots of things going on. But I think we just have to stay focused on what we're doing and solve the problems associated with AAV and demonstrate that we have solutions.
Efforts to truly understand, how to make AAV therapies more potent, better tropism, and importantly, better safety. And, and I am confident that in the future, this is, going to to be a rebound and, applications in many diseases.
The way I think of what the biggest challenges for CAR T or just cell therapy today is manufacturing it faster to the target dose for very sick patients. So you're taking cells out of very sick patients, trying to engineer them and expand them and grow them. So the current technology, I think, leaves a lot on the table, meaning the current technology for activating CAR Ts is sometimes has patients that won't expand. They're just too sick, or they have too few T cells. So you can't make a clinical dose for them.
It's really important to understand that there are a lot of individuals in Philadelphia with some college credit but no degree. So how do we really ensure that individual has a clear pathway to higher education? There's two skills that come to mind immediately, and that's communication and problem solving.
We are definitely going to see cell therapies expand beyond the kind of narrow niche of patients that are available that can be treated with these therapies today. So we're going to see a broadening to other therapies.
And I feel like the field is continuing evolving and continue to deliver innovative therapy for patients. I think that's really remind me why I still love this field, and is continue to evolve. New challenges continue to pop up, but then it's really a field that has tremendous promise for the patients.
Philadelphia is the center of the gene therapy. Basically, a lot of talents here and a lot of company here. I think it's a really good event.
I think that the balance of technical and broad information is just really, it's been right on at this conference. So it's been phenomenal.